Question 1. Which action demonstrates adherence to the right patient in medication administration? A. Asking the patient's roommate for identification. B. Checking the patient's wristband and confirming name and date of birth. C. Asking the patient's name only. D. Verifying the medication label matches the March answer. B. Checking the patient's wristband and confirming name and date of birth. Rationale. Verifying the wristband and confirming both name and date of birth is the standard for ensuring the right patient. Other methods are insufficient or unrelated. Question 2. A nurse is administering intravenous potassium chloride. What is the priority safety consideration? A. Administer the drug via intravenous push. B. Shake the vial vigorously before use. C. Infuse it slowly using a controlled pump. D. Mix it with calcium gluconate. Answer. C. Infuse it slowly using a controlled pump. Rationale. Potassium chloride must never be given intravenous push and should always be infused with a pump to prevent cardiac arrest. Question 3. What is the best nursing response when a medication label is unreadable? A. Estimate the dose based on experience. B. Ask another nurse to read it. C. Discard it and document the action. D. Call the pharmacy for clarification. Answer. D. Call the pharmacy for clarification. Rationale. If a label is unreadable, the pharmacy should be contacted for clarification to avoid medication errors. Question 4. Which step must the nurse take before giving a PRN pain medication? A. Assess the patient's allergies. B. Document the administration. C. Notify the provider. D. Ask the patient's family. Answer. A. Assess the patient's allergies. Rationale. Before any medication is given, especially PRN, the nurse must check for allergies to ensure safety. Question 5. What should the nurse do first if a patient says, "This pill looks different than what I usually take"? A. Administer it as ordered. B. Verify the order and double-check the medication. C. Ignore the concern and proceed. D. Ask the provider to come explain. Answer. B. Verify the order and double-check the medication. Rationale. The nurse must investigate discrepancies before administering any medication. Question 6. What is the safest action when administering medication to a confused patient? A. Leave the medication at the bedside. B. Ask the family to administer it. C. Stay with the patient until swallowed. D. Crush all tablets together. Answer. C. Stay with the patient until swallowed. Rationale. Direct supervision ensures the patient safely takes the medication and prevents hoarding or noncompliance. Question 7. Which situation requires an incident report? A. A nurse administers a medication 5 minutes late. B. A patient receives a double dose of insulin. C. A patient refuses to take a medication. D. A medication is given with food as ordered. Answer. B. A patient receives a double dose of insulin. Rationale. This is a medication error that must be reported to ensure patient safety and prevent recurrence. Question 8. What is the nurse's first action when a patient experiences an adverse drug reaction? A. Document the incident. B. Continue monitoring. C. Stop the medication. D. Ignore unless it worsens. Answer. C. Stop the medication. Rationale. The priority is to stop the drug to prevent further harm, then follow up with provider notification and documentation. Question 9. Which instruction is most important for a patient prescribed warfarin? A. Eat more green leafy vegetables. B. Take NSAIDs for pain relief. C. Monitor for signs of bleeding. D. Stop medication if feeling dizzy. Answer. C. Monitor for signs of bleeding. Rationale. Warfarin increases bleeding risk, so patient education must include signs and symptoms to report. Question 10. How should a nurse handle a situation where a provider's medication order is unclear? A. Call the provider for clarification. B. Ask another nurse for interpretation. C. Guess based on past orders. D. Administer the lowest dose. Answer. A. Call the provider for clarification. Rationale. Only the provider can clarify orders. Never guess or rely on assumptions. Question 11. What is the most effective way to prevent medication errors during handoffs? A. Use handwritten notes. B. Verbally tell the next nurse. C. Perform a standardized bedside report. D. Leave the information for the next shift. Answer. C. Perform a standardized bedside report. Rationale. A standardized bedside report improves communication and reduces error during transitions. Question 12. Which medication should the nurse question in a patient with a known penicillin allergy? A. Azithromycin. B. Ceftriaxone. C. Doxycycline. D. Levofloxacin. Answer. B. Ceftriaxone. Rationale. Cephalosporins like ceftriaxone may cross-react with penicillin and must be used with caution. Question 13. What is the safest method to identify a patient before giving medication? A. Room number. B. Ask name only. C. Use barcode scanning and wristband. D. Ask the patient's friend. Answer. C. Use barcode scanning and wristband. Rationale. This method ensures accuracy and reduces human error. Question 14. Which action is appropriate for a nurse preparing to crush a medication? A. Crush enteric-coated tablets for faster absorption. B. Mix all crushed meds together. C. Verify if the drug can be crushed. D. Use tap water to dissolve the medication. Answer. C. Verify if the drug can be crushed. Rationale. Not all medications are safe to crush. Checking is essential to avoid altered drug effects. Question 15. A patient is prescribed insulin. What is the nurse's priority before administration? A. Check the blood pressure. B. Monitor urine output. C. Assess blood glucose level. D. Measure potassium level. Answer. C. Assess blood glucose level. Rationale. Blood glucose must be checked to ensure insulin is administered safely. Question 16. What is a key teaching point for a patient starting a new antihypertensive? A. Stop the medication if you feel tired. B. Double the dose if you miss one. C. Rise slowly to avoid dizziness. D. Take it only when your BP is high. Answer. C. Rise slowly to avoid dizziness. Rationale. Orthostatic hypotension is a common side effect. Teaching helps prevent falls. Question 17. What should the nurse do before giving a high-alert medication like heparin? A. Skip independent double check if busy. B. Administer without verifying lab values. C. Perform an independent double check. D. Use an unfamiliar route if ordered. Answer. C. Perform an independent double check. Rationale. High-alert medications require extra safety checks to prevent errors. Question 18. A patient is prescribed vancomycin intravenous. What should the nurse monitor to prevent toxicity? A. ECG. B. Bowel sounds. C. Trough levels. D. Blood pressure hourly. Answer. C. Trough levels. Rationale. Monitoring trough levels helps avoid nephrotoxicity and ensures therapeutic effect. Question 19. Which finding requires the nurse to question a medication order? A. A toddler prescribed adult dose ibuprofen. B. A standard dose of acetaminophen. C. A delayed bedtime dose of levothyroxine. D. A scheduled antiemetic before chemo. Answer: A. A toddler prescribed adult dose ibuprofen. Rationale: pediatric dosing must be weight-based. Adult doses can cause toxicity in children. Question 20. A nurse receives a verbal order for morphine. What is the best safety action? A. Accept the order without repeating it. B. Administer the medication immediately. C. Write it down later during documentation. D. Read back the order to confirm. Answer: D. Read back the order to confirm. Rationale: verbal orders must always be read back to verify accuracy and prevent errors. Question 21. What is the nurse's priority when a patient refuses a prescribed medication? A. Document the refusal and discard the dose. B. Notify the physician immediately. C. Assess the reason for refusal and educate the patient. D. Ask a family member to encourage the patient. Answer: C. Assess the reason for refusal and educate the patient. Rationale: understanding why the patient refuses and providing education promotes autonomy and adherence. Question 22. A patient receiving digoxin reports nausea and blurred vision. What is the nurse's best action? A. Encourage food intake. B. Hold the medication and notify the provider. C. Administer the next dose early. D. Give an antiemetic with the next dose. Answer: B. Hold the medication and notify the provider. Rationale: nausea and blurred vision suggest digoxin toxicity. The drug must be held and reported. Question 23. Which action ensures safe disposal of a narcotic medication not administered? A. Flush it down the toilet. B. Return it to the pharmacy with another nurse's witness. C. Save it for future use. D. Place it in the sharps container. Answer: B. Return it to the pharmacy with another nurse's witness. Rationale: controlled substances must be disposed of properly with a witness and documentation. Question 24. Before giving a patient a new antibiotic, what is the nurse's priority assessment? A. Heart rate. B. Allergies. C. Creatinine level. D. Bowel habits. Answer: B. Allergies. Rationale: checking for allergies is essential to prevent anaphylaxis and ensure patient safety. Question 25. Which type of order requires renewal every 24 hours in most healthcare facilities? A. Routine orders. B. PRN orders. C. Controlled substance orders. D. Verbal orders. Answer: C. Controlled substance orders. Rationale: controlled medications require frequent review to ensure continued need and reduce misuse. Question 26. What is the best action when a patient questions the purpose of a medication? A. Reassure them it's correct. B. Recheck the medication order before administering. C. Administer it quickly to avoid delays. D. Tell the patient to ask their physician. Answer: B. Recheck the medication order before administering. Rationale: always verify when there is any uncertainty or question from the patient to prevent errors. Question 27. A provider prescribes a medication dose far higher than usual. What should the nurse do? A. Administer it exactly as written. B. Verify the dose with the pharmacy or provider. C. Ask another nurse to co-sign. D. Give half the dose. Answer: B. Verify the dose with the pharmacy or provider. Rationale: unusually high doses must always be questioned to prevent overdosing. Question 28. Which documentation best supports safe medication administration? A. Given as ordered. B. Administered per March. C. Administered 10 milligrams morphine intravenous for pain level 8/10. D. Patient comfortable after medication. Answer: C. Administered 10 milligrams morphine intravenous for pain level 8/10. Rationale: Specific documentation provides evidence of action and supports clinical judgment. Question 29. A nurse gives a patient's medication to the wrong patient. What is the first step? A. Report the error to the charge nurse. B. Monitor the patient and complete an incident report. C. Notify the healthcare provider. D. Inform the patient's family. Answer. B. Monitor the patient and complete an incident report. Rationale. Patient safety comes first. Incident reporting and monitoring are the priority. Question 30. Which route of medication has the fastest systemic effect? A. Oral. B. Intramuscular. C. Subcutaneous. D. Intravenous. Answer. D. Intravenous. Rationale. Intravenous administration delivers medication directly into circulation for rapid effect. Question 31. When is it appropriate for a nurse to administer a medication prepared by another nurse? A. During a busy shift. B. If the nurse trusts the coworker. C. Never, unless it is verified by both nurses. D. Only for emergency medications. Answer. C. Never, unless it is verified by both nurses. Rationale. Administering medication you didn't prepare is unsafe unless verified together. Question 32. A patient is prescribed a transdermal patch. What instruction ensures safe use? A. Apply over the same spot each time. B. Cut it if the dose seems too strong. C. Rotate sites and apply to clean, dry skin. D. Apply to irritated skin for faster absorption. Answer. C. Rotate sites and apply to clean, dry skin. Rationale. Site rotation prevents irritation. Patches should not be cut or reused. Question 33. What is the safest way to administer oral liquid medications to an infant? A. Use a household spoon. B. Pour into a bottle with formula. C. Use a calibrated oral syringe. D. Mix with cereal. Answer. C. Use a calibrated oral syringe. Rationale. Oral syringes ensure precise dosing for infants and are the safest method. Question 34. Which scenario requires the nurse to withhold a beta blocker medication? A. Blood pressure is 140/80 millimeters of mercury. B. Heart rate is 52 beats per minute. C. Patient reports headache. D. Patient is anxious. Answer. B. Heart rate is 52 beats per minute. Rationale. Beta blockers lower heart rate. Bradycardia is a contraindication to administration. Question 35. What should the nurse do before administering a high-risk anticoagulant? A. Check the sodium level. B. Check blood pressure. C. Review latest INR or APTT. D. Assess temperature. Answer. C. Review latest INR or APTT. Rationale. Monitoring coagulation values ensures safe administration of anticoagulants. Question 36. A nurse receives a chemotherapy drug from pharmacy. What is the priority safety measure? A. Ask another nurse to give it. B. Wear gloves and a gown while handling. C. Use the same needle for multiple doses. D. Store it at the bedside. Answer. B. Wear gloves and a gown while handling. Rationale. Chemotherapy drugs require protective gear to avoid exposure. Question 37. Which factor most influences the medication dose for a pediatric patient? A. Age alone. B. Weight and body surface area. C. Parent preference. D. Number of previous illnesses. Answer. B. Weight and body surface area. Rationale. Pediatric dosing is calculated based on weight/BSA to ensure accuracy and safety. Question 38. What should the nurse include when teaching about sublingual nitroglycerin? A. Swallow the tablet with water. B. Keep it in your pocket for easy access. C. Place under the tongue and don't chew. D. Take it after chest pain resolves. Answer: C. Place under the tongue and don't chew. Rationale: sublingual route allows rapid absorption. Swallowing or chewing reduces effectiveness. Question 39. A patient is prescribed metformin. What lab result would require the nurse to hold the dose? A. Hemoglobin 13.5 grams/deciliter. B. BUN 14 milligram/deciliter. C. Creatinine 2.2 milligram/deciliter. D. Potassium 4.0 milliequivalent/liter. Answer: C. Creatinine 2.2 milligrams/deciliter. Rationale: elevated creatinine indicates renal impairment. Metformin should be held due to risk of lactic acidosis. Question 40. What is the priority nursing action after administering for morphine? A. Check blood glucose. B. Monitor respiratory rate. C. Encourage fluid intake. D. Ambulate the patient. Answer: B. Monitor respiratory rate. Rationale: morphine can cause respiratory depression. Monitoring breathing is the top priority. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!